In this video by Deck Plate, we will be discussing neck conditions, some of the most common neck conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Cervical spinal fusion. Cervical spinal fusion is surgery that joins two or more of the vertebrae in your neck. It made your neck more stable. After surgery, you can expect your neck to feel stiff and sore. This should improve in the weeks after surgery. You may have trouble sitting or standing in one position for very long. You may need to wear a neck brace for a while. Most people can go back to work after 4 to 6 weeks, but it may take a few months to get back to your usual activities. How long it takes depends on what kind of surgery you had and the type of work and other activities you do. Cervical spinal stenosis. Cervical stenosis is a common cause of neck pain. It happens as there are changes with the vertebrae of the neck and the joints between those vertebrae. Bone spurs begin to form, causing cervical spinal stenosis. As the bone spurs grow, the spinal canal narrows and put pressure on the spinal cord and nerves. Causes of cervical stenosis. Spine degeneration is the most common cause of cervical spinal stenosis. As the disc degenerates, it loses water content. So as we age, our discs dry out and weaken, which causes the disc space around our vertebrae to collapse. As this collapse takes place, weight and extra pressure is put on our joints behind the spinal cord, and the tunnel that our spinal nerves exit through becomes smaller. Symptoms of cervical stenosis. Patients with cervical stenosis can experience numbness, tingling or pain in the arms, hands, and legs. They may experience spasms in their legs, making it difficult to walk. Diagnosis of cervical stenosis. If you visit for your doctor with back pain, your doctor will start by taking your medical history and performing a thorough physical exam. Your doctor probably will request an X-ray or MRI scan. These tests can help the doctor confirm your diagnosis of cervical stenosis. Ankylosing spondylitis. Ankylosing spondylitis causes inflammation that can lead to pain and stiffness in areas of your body. One common area you may notice this discomfort is in your neck. The pain may be especially noticeable first thing in the morning, at night, or after you haven't moved for a while. Ankylosing spondylitis causing neck pain. Ankylosing spondylitis can cause neck pain and stiffness in a few different ways. Inflammation of the cervical spine. Ankylosing spondylitis causes enthesitis, which is inflammation and the formation of scar tissue where ligaments, tendons, and other soft tissues attach to a bone. This disease process, which initially affects the lumbar spine, can eventually affect the cervical spine. For example, enthesitis can lead to more bone formation within a facet joint in the cervical spine, which continues the cycle of more inflammation and more stiffness. Nearby discs may also start to calcify, turn to bone, and stiffen as part of this process. Poor posture. While ankylosing spondylitis usually first causes pain and swelling in the lower back and hips, postural changes due to symptoms in these areas can also contribute to neck pain before the condition spreads to the cervical spine. Spinal degeneration in the middle and lower back can cause painful and stiffening spinal joints, which can in turn lead to reduced activity levels and weakened muscles. If muscles weaken and/or tighten in the neck, upper back, and chest, or if the thoracic spine starts curving forward even more, kyphosis, due to degenerative changes, then neck muscles and cervical spine joints can become stressed and painful while working harder to support the head. More commonly, a person who has ankylosing spondylitis in the early stages or only in the lower back can develop unrelated neck pain from a variety of other causes, such as from overuse or sleeping on it wrong. Increased risk for spinal fractures. For a patient with advanced ankylosing spondylitis, autofusion of the spine's motion segments can lead to long levers of fused spinal segments that increase stress in the spine. This is especially important with traumatic events or falls. Stress concentrates through the stiff segments and fractures can occur. In particular, the disc space is the weakest area and most vulnerable to fractures. Even after a minor trauma, an ankylosing spondylitis patient in pain must be thoroughly evaluated to avoid missing fractures. CT scans are indicated to identify the fractures, and surgical stabilization is often required to prevent neurologic injury. Diagnosis of ankylosing spondylitis. Symptoms of ankylosing spondylitis can be similar to more common back problems, especially in the early stages. Because of this, many people put up with the pain for some time before seeking help. It's important to see a doctor as soon as possible if you suspect you have ankylosing spondylitis. It's usually diagnosed by a rheumatologist. These are doctors who specialize in conditions affecting the joints, bones, and muscles. There is no one test that can show for certain that you have ankylosing spondylitis. A diagnosis will be made based on several things, including the history of your condition and the symptoms you've experienced, including whether pain and discomfort is waking you up during the second half of the night, a physical examination, blood tests, which may show inflammation, X-rays, or a magnetic resonance imaging (MRI) scan. Your age. It can be diagnosed at any age, but most often begins before the age of 40, and often much younger. There are disease activity and pain scores that can help doctors diagnose ankylosing spondylitis. Your doctor will ask if you have key symptoms, such as swollen and painful joints, especially around the spine, and fatigue. You'll be asked if you have pain in the mornings and how long for. Your answer to these questions could help lead to a diagnosis. Blood tests can confirm whether you have the HLA-B27 gene. Most people with ankylosing spondylitis test positive for HLA-B27, but so do many people who don't have the condition. A positive test may point to someone having ankylosing spondylitis, but it won't confirm the diagnosis. If you were a discharged veteran from U.S. military and looking for the compensation you can get for the neck conditions, please check out our other video on neck conditions with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.